Here's a hard truth that they are not going to tell you, probably because they don't know, and there's absolutely zero research on it, that the medical professionals are not going to tell you when they are using drugs to lower your immune system, because your immune system is on overdrive and potentially causing low egg quality, hormone issues, and early miscarriages. And I only stumbled onto this information in the quest to even diagnose myself for my unexplained infertility and why IVF wasn't working. I wasn't a normal case. I wasn't having reoccurring miscarriages. I was fit and healthy. All my labs were normal. There was like no reason why. We really demanded the autoimmune testing in a last ditch effort to understand what was going on. And even after a year of being incredibly healthy and improving so many different things, I still had high natural killer cells, which was affecting my ability to get pregnant. So when we were diagnosed, we had embryos on ice, and we did 3 frozen embryo transfers, all using immune suppressing drugs, including the interlipid infusion. It worked. I got pregnant for the first time ever, but had a miscarriage at 7 weeks, which means we didn't realize the baby stopped growing until we went for a heartbeat scan. After this miscarriage, I found some more missing pieces in my journey on a holistic physical side, especially the gut healing side, which was the root cause of why I was having issues in the first place. When you are using drugs to suppress your immune system so you can get and stay pregnant, they're going to use them probably a month before you start either your stem or the process to get the frozen embryo transfer. Then you're going to use them up to 12 weeks. This is because the placenta will take over at week 12, dramatically lowering the risks of your body rejecting the embryo or the fetus growing, because your placenta takes over and it's not your body anymore. And the truth is what they're not saying. When you get off those drugs, the issue is still there. The inflammation is still there. And this can really wreak havoc during a pregnancy, because you are now growing another human being. I think we just don't really realize, or it's not articulated enough, like what your body is actually doing. So when you're having autoimmune issues in the first place, it's your body, when you're presenting symptoms and you're not getting pregnant or whatever it is, that's your body's way of telling you, like, I'm not healthy, I'm not happy, I need support in whatever that way might be for you. And when that is going on, it's going to happen with even sometimes worse when you are growing another human being. That baby is going to suck the life out of you and take whatever you have, potentially causing you more issues after the pregnancy if you're not taking care of yourself, and potentially putting your baby's health at risk long term. The other thing that they can't tell you, because they've really only been using these treatments for maybe 10 to 15 years, and there's 0 studies on long-term effects of this medication, the baby's early development. If you actually go and look up what the baby, or how much the baby develops up to 12 weeks, you'll be godsmacked. It is so much, it's crazy. When you're using drugs like steroids or interlipids or Clexane, there's an effect. There always is. And they're never going to study it. They're never going to do a trial. It's unethical. We're really the trials, right? Us women who use these treatments. Now, the studies are out there already, and they're not really studies, they're more observations, that IVF babies are 30% more likely to have high risk factors and low birth weight, autoimmune issues, food sensitivities, ADHD, autism. And I personally don't believe it's the treatment, and not even necessarily the drugs per se, but it's more down to the father's sperm, and then obviously the mother's environment that this baby is growing in their first 9 months.